Some children fear dental visits, and they actually cry before entering the dental preparatory. But our aim as pediatric dentists is to make sure that children have a calm, a welcoming, and very friendly environment. In order to do that, you should be able to communicate to them in a language that they do understand. You should be able to lower yourself to their level so that they can actually relate with what you're talking about. Don't use very big words. Don't use English for adults. Talk to them in a way that they understand. Make sure that they relate with you. We also do make sure that the environment in your preparatory is child-friendly. The way you put on, whatever you wear, the way that the surgery looks like, it should be less threatening. If they don't like clinical coats, put on clothes that are warm and welcoming. It should have maybe toys. It should have a television that can show channels that are friendly to children. And then when you're treating them, when we are in treatment, talk to them in a child-friendly way. Talk to them in a language that they can understand. Different age groups will understand you differently. An infant may not understand you the same way when you're talking to maybe an adolescent. So tailor the messages that you give to them in a child-friendly way. So that is what we do to try to make them a bit calm. And then the other way is doing behavior management. That can be, even when we are doing procedures, we usually tell them, we tell them before whatever you're doing, you tell them this is what we are going to do. This instrument does this, something like that. Then we show them what we are going to do. This is what it does. This is how they feel so much with their hands. So you make their hands busy. They can actually help you in certain ways. And then you do the procedure. You show them, you do. Sometimes we also use like welcoming messages. Sometimes we also use, there are so many things that we can use. Sometimes we also advise the parents to talk to their children because they know their children more. So they talk to them, they tell them how the environment is not threatening, it's not going to be, even if it's going to be painful, if you talk to the child and make them aware of what really happens. You don't tell them it's painful, but you tell them how maybe it might be a bit uncomfortable, but it will be for a short time. Like you really talk to them in a way they understand. If the child comes when they are prepared mentally, in most cases they can comply and the treatment can go smoothly. Instead of telling them how threatening, how they hear stories of how so-and-so's tooth was pulled out and threatening things. Yeah, so as a parent, you also have a role in this. You talk to them about how the treatment will go. There are several things that can also be employed, like can watch YouTube videos. There are some nice videos about dental care for children, where they on YouTube, on Instagram, that show what brushing looks like, what a visit to a dentist looks like. So all that can be employed so that the child comes in when they are mentally prepared. The other thing we do is, I usually want to see my patients on appointment. Why? Because children are not meant to wait like for a very long time. The more they wait, the more they become anxious, the more they become disoriented, the more they lose that connection. So they should be seen in between 10 to 15 minutes. They shouldn't wait for more than 15 minutes when they come in. So it helps encourage them. It helps build their confidence even in the dental chair. So that environment is more welcoming, less threatening, and there's less anxiety for them. Yeah.